Hey guys, Dr. Kelly Ehlert here, owner of Priority PT. I'm at Juliet, Tennessee. So recently we talked about 5 ways that PT for the pelvic floor is beneficial. We just spent another 5 ways PT for the pelvic floor is beneficial. And we'll go through these really quickly. Reduce abdominal restrictions, letting the belly move. If you would like these, I can send these to you in a video, improving core stability and function for life and labor, improving ligamentous mobility, improving pelvic floor tension or relaxation for most of us. The most recent video was on how to modify exercises because there's a lot of scares and fears and myths around movements. Keeping the sacrum and pelvis mobile, trying to keep things moving and sliding and gliding as they should, and then keeping that stability in your hips happy. Today we're going to discuss 5 more reasons why pelvic floor PT is beneficial. 1, leaking. A lot of times the pelvic floor is doing as much as she can. Sometimes we have to train other muscles to pick up the slack, specifically the abdominals and hip rotators, to give that pelvic floor some help. I joke around that the pelvic floor is like the mom. She picks up the slack for everybody else when nobody else does all their miss. And a lot of times she's just overworked. Sometimes she's actually got a lot of pressure on her where she's at her max capacity, and we need to teach the pelvic floor how to reduce the tension to get some pliability and mobility back in the system. And then sometimes she truly is weak, and we have to give those pelvic floor muscles a reminder of what the heck they're supposed to do, and then load them, and then use specific techniques or positions to help pull baby back up and in, maybe using some spinning babies techniques, that kind of thing. Number 2, how to push effectively. We do not want that where we're bearing down and pushing with a closed glottis, where everything is pushing down and out, because typically that creates other issues that we have to kind of work through later on. We want to learn how to bear down gently or open the pelvic floor, use the uterus, use the activation of the contractions, and let the pelvic floor muscles relax, release, open, get into some birthing positions that facilitate that as well, help with mobility of the hips to open the outlet so that pelvic floor and pushing or working through and working within your own body can help. Reduce risk for perineal tearing. There are a ton of literature and there's a ton of support out there for perineal release. So this is pretty gentle, but getting into the perineal muscles and skin and doing some stretching, soft tissue release through that area can help reduce 3rd, 4th degree tears and even the risk for episiotomies or the need for episiotomies. Once again, a lot of this depends on how quickly baby comes during that, I believe it's the 2nd stage of labor, because a lot of times we can't get that tissue to release or stretch, especially when the baby comes really quick. But giving that time to stretch and helping those muscles kind of elongate and move, but also giving yourself that pressure so your mind body knows what it feels like to feel that pressure, so we're not pulling into it, we're letting go and letting our body do what it was made to do. There's also a lot of literature on heat compresses through that area to let that tissue stretch. So there's some cool stuff on that we can teach you. Number 4, a lot of us have this, going back to what I said a few slides ago, apical breathing, which can be because, 1, our diaphragm doesn't move, but also everything pulls us up. When that pulls us up, the brachial plexus, the nerves that run through down to the arm can get compressed, encroached upon, tense. We've got a few points of contact where those brachial nerves come through, specifically to the carpal tunnel. A lot of times if we can open up the cervical spine, open up the pecs, get you out of that postural pull where everything is just being pulled forward and your body is trying to find a new center of gravity, if we can get in there and get those joints moving, the muscles moving, give you some upper body opening techniques, that can give you a lot of relief through the upper body. Also, to learn what to do after delivery. So a lot of us go into pregnancy, and what I have seen a lot of people do is really kind of education on what can I do to prevent things from happening, education on what do I get for baby when I come home, getting a doula, but also knowing and running through things that you can do day 1 postpartum to help improve the integrity of your healing, help improve the integrity of your scar tissue if there is any, if there are any tears, what you can do day 1, day 2, day 16, whenever you're ready, to work on breathing, to work on core activation, to work on mobility, because most of us know mobility is how our body heals. Motion is lotion. And if we can get those cells, that tissue, the mobility, and the blood flow gently that it needs, we can heal better, heal quicker, and we feel more like ourselves. There are a lot of times where the body compensates really well, and retraining postpartum, getting those lower abdominals to fire, not the obliques, not overcompensating with some of the patterns I see all the time, can give us a ton of advantage of when you want to get back to heavier lifting. So I like to 2 to 3 week checkup postpartum to see if you're doing some of those compensatory patterns, just real gentle. We don't have to do anything crazy, but you are picking up a 5 or 10 pound item all day long. You're throwing around a car seat. So why not work within a 10 to 20 pound weight restriction and work on hinging, work on breathing, work on rotating, work on finding those muscles with functional movements to retrain that brain, retrain that body as things start to heal, that you have more control over your own body and you feel confident in your body as you get back to that 6 week mark, when you can start to do a little bit more activity, and even into that 12-week mark when you're able to do a lot more impact and possibly even running at that point. Would love to see you at our practice. Priority Physical Therapy, we're in Mount Juliet, Tennessee. We do one-on-one appointments for a full hour. We're with you the whole time, so you don't have to juggle. Would love to help you with any questions. Please shoot me a message, email, DM, all the things, and we can help you get back to feeling like you again and enjoy your pregnancy.